Internet connection was poor. Sorry, we got interrupted. Our internet connection was poor. We're back live again. We were talking about the COVID-19 effect on our communities with mental health issues going up, and also with recession kicking in officially and a lot of financial losses. That's also increasing people having a lot of anxiety and having uncertainty about the future. Both the financial and the health future is taking a toll, especially the seniors and people who already have pre-existing mental health issues. Um, Rashmi is here. Hello, Rashmi. She's a regular listener. Appreciate you tuning in. So we're going to have a detailed discussion tomorrow at our 4:30 broadcast at Facebook Live and YouTube and Instagram, as well as Periscope, on how to deal with mental health issues. I'll give you a few tips as a teaser to get you started and think about, till I give you a little bit more details tomorrow. I think establishing a daily routine is critical when you're in your bubble and self-isolating. Engaging in regular vigorous activity or exercise is critical in terms of increasing the endorphins and keeping you less anxious. Get outside. Going outside with Mother Nature does help you get you centered better. So, plus the COVID-19 transmission is less when you go out. Find ways to reach out to your friends and family by Skype, by FaceTime, by WhatsApp, and keep in touch with more regularity than what you used to before. I think that's a good support network. Connect with those who are self-isolating with you. I think it's a trying time with families in a tight bubble, and that sometimes increases anxiety, but it's a great opportunity to connect with your loved ones, and that will give you emotional support. Manage your news consumption. So I think every day going for 25-30 minutes, only maxing out on consuming news, and that to choose the sources wisely. It causes unnecessary anxiety. Too much news blasting at you from different sources makes you more anxious. So not more than 25-30 minutes of news consumption a day. Engage in a hobby. Hobbies like gardening or learning a new language or improving your certification if you're sitting at home for your job will help you. Practice mindfulness, and I'm a big proponent of that, and I'll give you some more tips how to do that tomorrow. So do tune in tomorrow at 4:30, and we'll talk in detail about these tips. And as I say with every broadcast, be gentle to yourself and others. I think it helps you with coping with the anger and the anxiety better. So all those tips we're going to post today so you can look through. We're going to also put some links tomorrow as well, and I'll give you some numbers like a 1-800 number if you really have a mental health emergency, or texting number. And I have a couple of apps which are good for mindfulness as well as COVID-19 related mental health issues. So we're going to leave that with our podcast tomorrow at 4:30. So do join us then. I'm going to give you a teaser on the breathing exercise. Dan is with us. He said, WIT3, thank you for great information. Thank you, Dan, for doing great service at Modern Plant WIT3. Appreciate you tuning in, and do spread the good word and share my podcast with other nurses at Plant so they can watch us live tomorrow when we go in detail. And then if they are working, we save it on our Facebook page at Mahajan Medical Center, so you can follow us there and check out other podcasts there. And I think Dan brings a important point to my mind, that a lot of mental health issues are affecting the nurses, the physicians who are working in the healthcare field, the grocery workers, the delivery workers. So the tips I'm going to give you tomorrow will help our colleagues and our co-workers in the healthcare field, along with the other fields as well. We're going to talk today about the new breathing technique I'm going to teach you. Yeah, I'm very excited about that. It's called breath of fire, or other name in yogic circle is Kapalabhati. It's a pranayama or breathing exercise where you engage your muscles below your umbilicus, about 3-4 inches below your belly button, just above your pelvic bone in the middle, somewhere around that. One of the best way to locate that muscle is to cough, like, and then touch your muscle just below your belly button, and you will see that muscle contract. So cough with me one time and put your hand just below your belly button and see if that muscle contract. Now that's the muscle you need to focus on. And what you need to focus on in Kapalabhati breathing is to exhale. Inhalation should be automatic. So in other words, you exhale out by pushing that muscle back. So like this. So basically I'm pushing the air out in exhalation, and the inhalation is automatic. So if you can do 1 beat per second, that means 1 exhalation, inhalation per second, that'll be ideal. Or take your time, don't force yourself, start slowly. So that will, it's called Kapalabhati. Let me show you. Put your hand just below your belly button, and, breathe out or exhale out from there, from your nose, like this. And count 20. So that's Kapalabhati for you. If you can do it up to 100 as you build it up, it will help you develop your strength in your core muscle. It opens up your sinuses, and you can go in deeper meditation because it's called breath of fire. It's a very aggressive breath, and also it clears up your skull. The Kapala in Sanskrit means skull. Bhati is illumination. So that's why it illuminates the skull, or get you more clear skull or clear brain. So that's a fantastic workout for your breathing. Or if you want to go in deeper meditation, just before that, you can do the breath of fire or Kapalabhati. And I'll go at length tomorrow as well. So we're going to see you guys at length about mental health issues related to COVID-19 and healthcare workers and everyone else who is self-isolating at home, and the anxiety of unknown, and financial anxiety, and healthcare anxiety, and health issues anxiety, and when the pandemic will end, a lot of uncertainties causing us to be more anxious. So we're going to be talking about that tomorrow, along with Kapalabhati at 4:30. Do tune in. Till then, be nice to yourself, gentle to yourself, to people around you, and also be kind to the biosphere. With that, I'll see you tomorrow. Ciao.